Hello friends, I'm here with my next video on pharmacology. Let's learn pharmacology. So friends, in this video we are going to discuss on pharmacological therapy of hypertension. In the last video we discussed about hypertension, that is what happened in hypertension, what is hypertension, its diagnostic evaluation and the treatment of hypertension by lifestyle modification. Today in this video we are going to discuss on pharmacological therapy. Means what are the drugs used in the treatment of hypertension. Here we have various groups of drugs are used in the treatment of hypertension in hypertensive patients. We call those drugs as antihypertensive drugs. So here coming to the classification of antihypertensive drugs. So we have 7 classes of hypertension, that is we have 7 classes of antihypertensive drugs. Remember this classes as 2As, 2Ds and CVS. 2As, 2Ds and CVS. So first coming to 2As. First is ACE inhibitors, that is angiotensin converting enzyme inhibitors. ACE inhibitors, 2As. First is ACE inhibitors. Next is angiotensin 2 receptor blockers. We can call it as ARBs. Next 2Ds. 2Ds means direct renin inhibitors and diuretics. Direct renin inhibitors and diuretics. Next coming to CVS. CS is calcium channel blockers. C is calcium channel blockers. Next is CSV. S is sympatholytic agents. V is vasodilators. Now coming to the drugs which comes under each classes. First is ACE inhibitors. Here we have captopril, enalapril, lisinopril, ramipril. This comes under ACE inhibitors. Or remember these drugs as the drug name ending with pril. The drug name ending with pril, this drugs comes under ACE inhibitors. Pril comes under ACE inhibitors. Next is angiotensin 2 receptor blockers or ARBs. Here we have losartan, candesartan, valsartan, telmisartan, olmesartan. Comes under angiotensin 2 receptor blockers. Sartan comes under ARBs. Pril comes under ACE inhibitors and sartan comes under ARBs. Next is 2Ds. First is direct renin inhibitors. Eliskiren comes under direct renin inhibitors. It is usually given in combination with other drugs, with other antihypertensive drugs. Next is diuretics. In diuretics we have thiazides, hydrochlorothiazides, loop diuretics, bumetanide, torsemide, potassium sparing diuretics, amiloride and spironolactone. With this we are done with 2As and 2Ds. Next coming to C. Calcium channel blockers. Diltiazem, verapamil which comes under subclass phenylalkylamines. Nifedipine, amlodipine. This comes under dihydropyridines. Diltiazem, verapamil, nifedipine, amlodipine. These are the calcium channel blockers. Next is vasodilators. Here we have nitroglycerin, sodium nitroprusside and hydralazine. Nitroglycerin, sodium nitroprusside and hydralazine. Next is sympatholytic agents. Here we have centrally acting sympatholytics. Clonidine, alpha methyl dopa comes under centrally acting sympatholytics. Next is beta blockers, alpha and beta blockers, ganglion blockers, neuron blockers. So here is beta blockers, atenolol, metoprolol, esmolol, propranolol. This comes under beta blockers, alpha blockers. Prazosin, terazosin, doxazosin comes under alpha blockers. Remember this as zosin comes under alpha blockers. Drugs ending with zosin comes under alpha blockers. Next is beta blocker and alpha blocker, or we can say it as beta adrenergic blocker with additional alpha blocking activity, or else alpha and beta blockers. Labetalol, carvedilol. LC comes under alpha and beta blockers. Next we have is ganglion blockers. Trimethophan comes under ganglion blockers. Neuron blockers, reserpine. Neuron blockers, reserpine. So with this, we are done with 2As, 2Ds and CVS, or with the classification of antihypertensive drugs. Here I am making it short for you so as to make it easy for you so that you can clearly understand the classification of antihypertensive drugs. In the next video, we'll be discussing about the mechanism of action, uses and adverse effects of each drugs. Thank you for watching my video. Please don't forget to like, share and subscribe to my channel. Thank you once again.